women with having complicated deliveries, what you say is when a baby is big and is trying to take out, either they use a forceps as a device to get the baby out, or you do an episiotomy where you do a small cut of the muscle to get the baby out, or if it was like a long and complicated delivery.
Exactly.
So that is why constipation is very common in females.
Yeah, absolutely. Yeah, so outlet obstruction is a very common issue. So we can diagnose that with many things. One option is to diagnose it with good old rectal examination, right? So essentially, the doctor would ask you to squeeze and then push the finger out, and they can see that the coordination is gone. There is a formal test, anorectal manometry, to see if the synergic defecation is.
So that is just for the audience, I'm explaining. Anorectal manometry is a small balloon that they insert into the rectum.
Yes.
And then they measure the pressure of the sphincter muscle.
Exactly. So it's a catheter with a balloon at the end of it, right? And this catheter has some sensors on it, and also the balloon also measures the pressure. So a catheter sits and kind of straddles the anal sphincter, and the balloon sits in the rectum. So when you squeeze, the pressure is taken. When you push, the pressure is also taken by the rectal sensors and also anal sphincter, and you can see whether there is discoordination. So the good news is that when we find this, the treatment is actually biofeedback therapy, which is when we ask our nurses or a physiotherapist to teach you how to do this. Essentially, it's you're going to gym for the pelvic floor, right? So basically, you're training this neuromuscular circuit from the abdominal muscles to the pelvic floor to the internal sphincter and the external sphincter muscle. Exactly.